Justin Tomlinson. Justin, you're standing for in the North Swindon ward, hoping to become the Conservative MP for that ward. How did you think last night went? What did you think your boy did?
Well, I enjoyed it last night. Like a lot of people, I was glued to the TV. I mean, as a candidate, and I think this would be the case for all of the candidates, we're pounding the streets, working extremely hard. But in reality, the bigger picture, the national debate will determine a lot of our futures. So myself and all the other candidates were glued to it. I think it was an interesting debate because people thought it would be too well rehearsed and there wouldn't be an actual debate in there. And I think there was enough to create interest with the people who watched it. I thought from our perspective, I thought David Cameron did very well. He answered questions directly. There was a lot of pressure on him last night because he is the favourite to become the next Prime Minister. So people were looking at him in that way. And obviously Gordon Brown has the experience as the current Prime Minister. But I thought David Cameron was very good because he was direct and he was the only one to apologise over the expenses issue, which is something that is coming up time and time again on the doors. So I was pleased. There was no killer blows for any parties. I think Nick Clegg has done well. It's been shown in the polls. But interestingly, the poll which said who would make the best Prime Minister following that, David Cameron won that one. And that's probably the one in the long run that's going to count.
So we are actually going to accept in this discussion today that polls are a good guide.
Polls, the only poll that really matters is the one on the general election
Yes.
day itself. But they are a good indication of trends. But as we see with this election, any other election, a day is a very long time in politics.
OK, Justin, let me ask you a very simple question then. Look, we have the greatest debt that we've ever had in our history. Mm-hmm. We have gone through a disastrous period. What's gone wrong? Why aren't the Conservatives streets ahead? Why are they still struggling and talk of a hung Parliament?
Well, first of all, I'll address the hung Parliament issue. The Conservatives need to be approximately 7 points ahead in the polls if there is a uniform swing to actually win with a majority of one seat. The way the electoral system works in this country, that the spread of votes isn't even, and we have a inbuilt disadvantage, but we are where we are, and that's something that we as a party must address and win by at least 7 points in the polls. In terms of the economy, we're in a complete and utter mess, and it is being made worse. Yes, there was a global recession, but when the sun was shining, our Labour government did not put money aside like all of the other major European countries. And when, like all other major European countries, started to release money into the economy, we could only do that by borrowing, and that money will have to be paid back. And if we do not address the debt, interest rates will start to increase and further pressure will be put on to unemployment and things that affect people's day-to-day lives.
Yeah, but the question I asked was, why are we still talking about hung Parliament? Why are you not streets ahead? What's actually gone wrong? Why are people not getting behind the Conservative Party and saying, right, these are the guys who are going to push us forward? Mm-hmm. Because for some reason, we're shilly-shallying around, aren't we? We're not sure which way it's going to go.
Well, I mean, we've had a Labour government for 13 years. People know what they get with a Labour government. It is up to us to now sell a positive alternative. We need to seal the deal. We haven't done that yet. I was listening to Anne, who was on before me, and, you know, everything is to play for. I'd love us to be 20 points ahead in the polls. I'd be, like any other Conservative candidate, sort of with a real spring in my step. But there is a real opportunity for us to win this general election and a real opportunity to make a positive difference to the people, not just in Swindon, but across the whole country. There is still much more to do. 3 more weeks to go.
OK, let's move on to the issues then, and say that I'm going to quote from Winston Churchill when he said, "I have nothing to offer you but blood, sweat and tears." Now, we've spoken about the fact that we are in a really serious financial situation. Mm-hmm. The Conservatives have actually said they're going to cut back government spending. Mm-hmm. How many jobs is that going to lose?
Well, what we've got to look at, first of all, is protecting jobs right across. I mean, when I talk to people on the doors, first of all, across Swindon, we've had the fastest increase in unemployment in the country. And secondly, those people who still have jobs have uncertainty. And this is the first time in a generation that's been the case. People wanting to plan whether they should move house, whether they should take on a mortgage. Uncertainty doesn't help the economy. And we need to set out a clear plan to start tackling that deficit, to keep down interest rates, to protect businesses, to get people back into work, back off benefits, and that will help. What we've seen under this Labour government is unemployment rising, and bearing in mind that the figures don't include the people who are not active workers, as Labour creates lots of sub-lists to try and hide the true extent of the people who are not actively working, which is somewhere in the region of 7 million people. It is essential we get people back into work, back off benefits, helping to generate the taxes that will pay down the deficit and reduce the burden onto welfare.
Yeah, but Justin, with respect, £1 in every 100 is being saved, right?
That is what we have asked for to fund. That quote you're using, the £1 in 100, is what we would seek to find as savings that there is in waste within the public sector to prevent the national insurance tax hike, which is a tax on jobs, which all of the leading major businesses are saying will lead to increased unemployment, which is the last thing we do. When you're in a recession, when you've got increasing unemployment, the very last thing you do is put further burden, further taxes onto employment. This is people's lives. People need to go to work.
But we've said that we're not going to affect National Health Service, the largest employer in the country. We're not going to cut back on policing. We're not going to go cut back on the army. Where is the axe going to fall? Because that £100, £1 in every 100, suddenly starts multiplying up to the areas that you are going to hit significantly. We need to know before the election where they're going to be and what effect it's going to have. How many people in those areas are going to be out of work?
Well, it is only the Conservative Party who is opposing the tax on jobs. We are the only party determined to drive down unemployment rates, giving people a great opportunity. Now, going back to your £1 in 100, nobody credible can tell me there isn't £1 in every 100 that government agencies, councils, public sector organisations waste. We could all come up with a long list of examples. We could get your listeners to send in examples of where waste takes place. When I first got elected as a council, there was so much waste in it, and over the years since 2004 that we've run the council, we found £52 million worth of waste which we've been able to remove, some of which is then used to improve frontline services. You rightly said that we're protecting the NHS. That's our number one priority, and we will see an increase in funding in areas such as the NHS. You also mentioned defence. It's important that for our brave troops out in Afghanistan that they're given the right equipment. We just need to do everything we possibly can, rolling up our sleeves. If we have to work 24/7, we have to. We have to get better value for money and protect jobs, because turning to putting taxes on jobs, the national insurance hike that the Labour government, supported by the Liberals, want to do, will kill the recovery and we will have a double-dip recession.
Now, we're talking about protecting the NHS. What sort of protection is that? Is that protection so that there are no more cuts in the NHS? Or are we talking about protecting it so that we are going to give it rises in line with the cost of living? Or are we going to protect it because we're going to give it rises in line with the health service cost of living? Three things there.
Absolutely. I mean, we have a commitment that there will be a real-time increase in funding for the NHS year on year in a Conservative government. It is the number one priority of David Cameron and the Conservative Party, which I support as a Conservative candidate and a local resident, for which many of my friends and myself included have used our local hospital, so it's extremely important. The town I grew up in, Kidderminster, saw its hospital closed down, and I've seen what a devastating effect that can have into the communities, and it is right that the Conservatives have made that the number one priority. Now, what we also need to do is we need to remove the bureaucracy, the politicians' interference with the NHS. There's so much meddling going on, so many changes of direction. We need to trust the doctors to get on, run and make those decisions, freeing up additional money to fund frontline care, giving patients greater choice and quicker treatment times.
Sorry, how do you do that? I wasn't quite sure how you connected that. You were saying you need to free up the doctors.
Well, at the moment, as an example, there are more administrators in the NHS, bureaucracy, than there are beds. Now, that is madness. What we need to do is we need to put trust into the doctors. I mean, I visited the hospital. I visited many hospitals in my time involved in politics, and we are forever being told common sense is being removed because they're having to jump through ridiculous targets. We had the case with the Staffordshire Hospital, which was doing very well according to all the targets, but then it was an unmitigated disaster. That is totally and utterly unacceptable. We need to trust the medical staff to get on with what they're paid to do. That frees up the money to put into frontline patient care.